I am Professor Dr. Vivek Gupta, along with my team of members in Apollo Hospital, New Delhi. This is Corona time. As you can see, we all are scrubbed heavily, and we have taken the face shield, double mask, N95. Myself, Vivek Gupta, on 11th of June, around 5:15 p.m., along with my nurse, Lalita, and Mr. Chandan, and Dr. Nikesh Mishra, who is our DNB first year student and is doing helping us with recording. So I'm going to show you a live case of angioplasty in a patient who has got a critical blockade. Critical blockade, show the blockade in the mid allay. So you can see it very clearly, it is a blockade. Okay. So I'll go one by one. The first step is that we have to give a local anesthesia and then we have to do a puncture. For the purpose of live, I am going a little slow. As you can see the blood, this is actually the femoral artery and we have punctured it very nicely, and there is no blade which is used, show everything. And now we are going to put the sheath here. This sheath will go inside and now we take out the wire. This is known as Seldinger technique of putting something inside, directly inside the femoral artery. Now I will also do a femoral vein puncture and I need one more sheath. As a protocol, I personally feel that femoral vein is also equally important to have it. And you can see with the one puncture I have got the vein. Now sister is not well prepared, so I am using the same wire which was used actually for the purpose of arterial sheath. Everybody says, I was not boasting, that my puncture is very quick and sometimes I have to wait for the preparation of the sheath. Now they have to prepare the sheath. So with the one prick, we got the puncture arterial as well as venous. So basically arterial puncture is for the purpose of going into the coronary arteries and also the blood pressure monitoring. So these things are very timed well, and I am going to check the blood pressure now. The arterial blood pressure, and you can see the screen on the top. We have pressure about 140 by 80, which is quite good. So okay, come back to me. So now the process of angioplasty starts. I'm not satisfied. We'll give heparin. 10,000 heparin we are going to inject. So through the vein, we'll inject 10,000 intravenous heparin. This is anticoagulant. Because after all, angioplasty, when we are doing angioplasty, we will be putting the stent. And the stent is a foreign body. The stent is a foreign body. Now we are taking the catheter. Your movement should be slow. So I am taking that this is actually a specially designed catheter. This Judkin? Not implants. Okay, so this is Judkin catheter, which we'll use for the purpose of putting the wire, balloon, and then the stent. We will do this Judkin catheter with the help of wire and the fluoro screen. Show the fluoro now. You can see the wire is going up, and at the same time we are putting the catheter. This is the fluoroscopic machine which is helping us to see where we are going. So now I am connecting again here, and with this help of a tube, we'll see where we are. So we are already engaged. So this is known as engagement, and I'll take a shot. Keep showing there, keep showing. So it is very good demonstration of a good angioplasty. There are two views which we are taking here. We are injecting the dye, and with the help of dye we are finding out the blockages. I want the intravenous fluid to please fast increase the volume of the fluid. What are you doing? I want to do angioplasty. You have to connect this. Okay, come back to me. So this is Facebook Live, and I want to show. We are being helped by the second. You have to give the wire, tubing, tube. Okay, leave it. You have it? Okay, so show to me. Show to me, yes. When there is something going on, you have to show me. So the whole procedure is actually without anesthesia. Patient is fully conscious. ठीक है आप? आप ठीक हैं? ठीक है, okay. The patient is fully conscious.
ठीक है.
And we are going to start the angioplasty. One procedure was missed out by the nurse. So this is very important, sister. Don't show the blood. Okay. So we are now ready to put the wire, and the guiding catheter is already engaged. You can see a lot of blood coming, but this is a non-surgical process, so as such we are very safe. Only show my face. This is the preparation for putting the wire. This is a very important step, because we have to be air free, completely air free. Sister, can you put the sheet? So now I'll show you what it is. This is a wire, very thin wire. Very thin wire which goes inside the heart, coronary arteries. Okay, leave it. I think I need to give some more fluids. Okay, give me 20 ml syringe, or I will connect this. This is the fluid?
Yes.
Huh? Are you sure? So I'll connect the fluid to give more fluid to the patient directly. Show my face. So what we are doing is, because the patient is actually almost nil orally since morning, so we give extra fluid to keep the pressure up. You can. Just ask fruit चल रहा fast. I think it's okay, na?
ठीक है सर, 110.
So this is a very important part. If you have venous sheath, I always tell all my fellows that always during angioplasty you may require actually a venous access. So this is basically going to live, so a lot of doctors will also see. Something is important for the patient, public, and something is important for the patients and doctors to learn. Suppose if I had no, lot of people don't use the venous sheath, and if they require to give fluids, it becomes a little difficult for them to puncture again. So I check again whether I'm well inside the coronary artery. So I'm well engaged. Okay, go to epicranial. So this is the wire you can see, very thin wire, which goes inside the coronary artery. So there. Come to the epicranial. Are you? Epicranial. This wire is going inside the LED. Are we right in place?
ठीक है
Huh? ठीक है?
और तो हम
Okay. So I'm satisfied with this. I'll check short to see the patency and the correctness of the wire. So I'm satisfied that we are in the right branch. Then I take a balloon. Come back to me. So through this wire, we'll put a balloon. Normally I do a little faster than this, but as I'm demonstrating, so we have to see the everything. And this is the balloon you can see, very thin balloon, which will go inside the heart in the coronary arteries through this wire. This is again a very special thing. It takes time to learn. Hold the wire, sister. Now we are putting this balloon inside this through the sheath. Hold the wire. Leave the wire. Leave the wire. Hold the wire. Okay. Now the balloon is going. I will show you on the screen. You can see the tip of the balloon coming inside the coronary artery. Two tips of balloon. You'll notice that two tips of balloon has come here. Negative. I will check the position of the balloon right at the level of the blockage. So we are right at the level of blockage. We have to be very sure that we are right at the level of blockage, and then we will inflate the balloon. So this balloon is getting inflated, and we have gone to 6 atmospheres, so that you can see the balloon is inflated. This is the balloon which you are seeing, and we deflate the balloon. Take out the balloon. This is how we take out the balloon, while the wire remains there. Because the same wire we will use the stent to go inside. So I will check again, slow movement of the mobile. I will check again with the dye that we have opened the vessel. Now you can see, show the middle portion. Now we have done the balloon, and this is what the artery is half open. Now we'll put the stent quickly, 2.75. 315. So we have to be very sure of the size of the stent and the diameter of the stent. The stent is a hollow cylinder which will go into another cylinder. A heart arteries are like a pipe. So pipe means cylinder, if you know the physics. So one cylinder is going to another cylinder. So my technician is opening up the stent, which is coming prepared, and we're using the bichronic stent. This is the stent sizing. This comes like this. Actually, stent is on the tip here only. You can see the stent. It's a very small diameter. This is undeployed stent. As we had put the balloon, this is going live, no?
Mm-hmm.
Can you see?
Mm-hmm.
Okay.
Comments are in.
Okay, so you can see the stent is going up. Now the stent we will put in the same vessel like that. Patient is fully conscious. Namaste. ठीक है आप? Very good. Patient is all right. What relaxes to 20 mg? 20 mg. IV. Okay. This is 10 mg, 10. Yes, you can see. ठीक है, saturation का लगा हुआ है. ठीक है? Okay. So you can see the same way the balloon went, the same way stent is going. Show my hand. So we are showing it like this. Close the light. You can see the movement of my hand. Close it. Yes. You can see the movement of my hand. And we are taking the stent inside. And you can see the stent is here. Show the picture. So I have to again check with the help of dye the location of the stent. That is very important. So I am satisfied overall with the position of the stent. Okay? Are you satisfied? Or should we take another picture? छोड़िए, सिस्टर बाय बाय छोड़िए. 3 का है ना? और 15 है. I think we should not go down, है? सब कुछ कर दें.
नहीं, इंटरव्यू ठीक है.
हाँ?
ठीक है. मार्कर से जस्ट पहले. ठीक है सर.
Okay. So now I am satisfied with the position of the stent. Just show me, come Nikesh. Now I will again inflate with the help of inflation balloon. And I will go to 12 atmospheres. This is how it goes to 12 atmospheres. And show me there. The stent is inflated. The balloon is inflated. And we'll keep it for 30 seconds like that. आपको दर्द हो रहा है क्या? दर्द नहीं हो रहा. कोई बात नहीं, ठीक है. Nicoran infusion. Nicoran. अभी तो बना लिया आपने? बना लिया. लाओ. So the stent is deployed. Boost it. Nicoran. पहले तो बना के रखना चाहिए था ना. Okay. I'll check the position of the stent. It's fully deployed. It will go live. You can see the stent is fully deployed. There is some minimal notching of the diagonal, which is not a big branch, but it is still alive. So I'll take out the balloon now. Record कर दे. इसके साथ. Show the boost. Okay. This is stent boost, which shows the deployment of the stent. I go to second inflation, just to be sure the stent is fully deployed. Okay. So, give me Nicoran. So, as a protocol, I always give Nicorandil intracoronary so that all the channels remain open. We can also give intracoronary nitroglycerin, but I feel Nicorandil is safer because it does not lead to hypotension. The sisters are preparing the Nicoran, which will be only 2 mg. How much we give? You know how much we give?
Sir, 1 ml is equal to 1 ml.
1 mg. So before taking out the balloon, in fact I can take out the balloon now itself, but still to be on the more caution, I will inject Nicorandil. Show me there. And now I will take out the balloon. Okay, show me here. Come. So I am now taking out the balloon. In fact, I'll take out everything. This is how the stent is still there, but we are taking out the balloon. So this is the beauty of this procedure, that we leave the stent there. The balloon is a carrier. And now we take the final shot, and the blood pressure is perfectly fine. Show the blood pressure. Wire is almost out. Okay, I'll just take a final shot. And the artery which was blocked is completely open. I'll take out without the wire. One more shot. And you can see the artery is fully open. Now I remove everything. Plus before after दिखा दो. and remove everything. Can't do. Before. So this was before. Put your hand there. Finger. Yes, this was the blockage before. This is a different position on the private. And this is after. Artery is fully open. Come back to me. So I hope you have realized that the artery which was blocked by 80-90% is now completely open with the help of stent. So I have removed everything. You can see here. My hands contain the blood, but does not mean that it's any cut. Show here. So with the help of two sheath only, no cut, no surgery, we have been able to put the stent inside the coronary artery of the heart. This is known as Seldinger technique, and the patient is perfectly all right. आप ठीक है?
हाँ ठीक
Perfectly all right?
है जी
Very good. दर्द ठीक हो गया?
दर्द तो है हल्का
हल्का ठीक हो जाएगा अभी.
हल्का सा
Different infusion. So this is the procedure of angioplasty. I am Dr. Vivek Gupta in Apollo Hospital, and Dr. Nikesh Mishra is very nice to do the recording for the Facebook Live. I will show his face a little while later. So this is a corona time. Today is 11th June. Since November we are suffering. So because normally they never thought of wearing the mask and this, because this is non-surgical procedure. Now we have to be very sure, although this patient is COVID-19 negative, that means it is not positive, but still we have to be very cautious. You can see our come here. We are so heavily draped. It's not PP kit, it's a sort of PP kit. So you have seen everything now. Angioplasty was first discovered. Let me tell you the historical part. This is non-surgical technique of opening the blood arteries. It came in the light in 1977 by Andreas Gunzig. 1977 in Germany. The first stent was done by our friend Ulrich Sigwart in 1987 in Lausanne in Switzerland. I worked with Professor Alan Trippier before in 97-98. And I have no hesitation in saying that I was the initial first to start a complex angioplasty. This is a routine angioplasty, but lot of time patient and the family, they are very scared. They take long time to decide, and sometimes the decision pending is sometimes really causes the life or some more difficulties. So overall, the procedure is simple. What I have demonstrated today is, we started at 5:15. It is 5:35. It's about 20 minutes from puncture. Normally my time, which they have recorded, my technician, is 6 minutes for one stent. So in this case, we have taken about 15 to 20 minutes, starting from puncture to the putting the balloon, wire, guiding catheter, fluids given, everything. So I am very much satisfied with the result. The purpose of this demonstration is there is a lot of fear in the mind of the patient and the family that this is a surgery. It's not a surgery. We do like surgery, but it's a non-surgical technique. We are using lots of things like this, and I would like to show you the last picture. I will come there. Mr. Nikolai, go there for back. So you can see there was a blockage, tight stenosis here. After putting the stent, this is a main artery, LAD. There is absolutely no block. So this is the beauty of this procedure, that you can do everything without bypass surgery. Earlier, before 1990, even today, lots of hospitals, and if you go to the surgeon, they would like to operate open bypass surgery, opening the chest, putting the wire, putting the graft. So now, with the help of angioplasty, there is absolutely no need. Let me introduce my friend Chandan, who is a technician, and I'll introduce yourself, Dr. Nikesh, who was very nice to do a recording. And just to tell you that these procedures are common, but we are really scared of corona. Let me show my face in the end. Show your face, and then you can also. So in the time of corona, we have been able to do procedures. We have personally, a lot of things have been done. And now we finished the procedure. Thank you very much for knowing this procedure of angioplasty stenting. And today is 11th June. Thank you very much for watching this video. I am Dr. Professor Vivek Gupta in Apollo Hospital, New Delhi at 5:35 p.m. Bye-bye.